What's going on, everybody? We're really excited to once again have Dr. Assif with us today. My name is Eugene, found also on Instagram as Eugene Does Hair. We have Angela Cho, creator, founder of Lady St. Lucia Lashes. And we're here again with Doctor. We're on this discussion right now of acne. Last time we did more topical treatments for acne. Today we're going to talk about internal treatments and antibiotics for acne. So, Doctor, give us some information. People want to know what are some options as far as internal acne treatments.
That's right. So last time we talked about topical treatments, which is the basic things. People can all the time go to. I don't want to repeat myself, but we already record the first episode for our acne treatments. We talk mostly about topical. Today we're gonna talk about like a little bit advanced acne treatment, which is basically it's oral and hormonal therapy. And we use that if the topical didn't work, then that's like the second step. So first we're gonna start with oral antibiotics. So oral antibiotics, the bacteria in acne bacteria, the best antibiotics we use right now is cyclines, which is you can if you see in here, we can use either minocycline or doxycycline. But basically myself, I use doxycycline. It's it's well tolerated by most of my patients. It may cause some, like all antibiotics, it may cause some, gastric upset or gastric pain. Also, it can cause some, like you say in here, some, when you taking these antibiotics, it may cause also like sun sensitivity of the sun. So you basically, when you use these antibiotics, you better use some sunscreen. So the other antibiotics we use is erythromycin. Basically, erythromycin, to be honest with you, I have not used it for a long time. And it's really bad for your stomach. A lot of people, it's very hard in your stomach, but also it's becoming a little bit of, have some resistance to these bacteria. So I would recommend mostly when somebody will want oral antibiotics, if that topical that didn't work, I use oral antibiotics, especially doxycycline. And the dose for doxycycline, it's between 500 milligram and 1 gram a day. If you see like the oral antibiotic therapy, the adverse events for it, so all of them, they will cause some gastric, pain. So all of them, monocycline, erythromycin, everybody. And a lot of them, they will also cause, so like minocycline, they may cause some hyperpigmentation. A lot of them, erythromycin also, they cause some headaches. So I don't want to give erythromycin for people with, migraine headaches or anything like that. But most of them, they will cause some gastric, sun sensitivity. But I like doxycycline the most. That's for oral antibiotics. And Eugene asked me last time how long if we start oral antibiotics. Eugene asked me last time how long. Well, minimum.
I think most people, when they think of acne treatments, like they want to know, like that's I think a first question that a lot of us want to know, like when we're going to do something, wait, how long is it going to take before I can see a difference? So what were you going to say as far as the time frame?
It's a great question, Eugene. The frame time will probably start seeing stuff, but within a month, within 1 month, 2 months, really clear up. And like acne treatment, you have to be very patient. You cannot see that, like today you start a treatment like in 2-3 days. It takes about 2 to 3 weeks to 4 weeks to start seeing. But if you follow that treatment, you're gonna see the results.
Now, when somebody takes these, though, I'm sorry, doctor. When somebody takes an antibiotic, should they also be taking a probiotic, or is that something that's addressed after? Because you were saying it can upset the stomach.
Yeah, no, they can't take probiotics. You know, probiotics are different.
Okay.
They use in your intestine, and the probiotics are good. You can take both at the same time. It's not a big deal. Probiotic and antibiotic,
Okay.
they do different things. I don't want to get into probiotics, but you're right. You can take probiotics. But I love probiotics, to be honest with you. When I don't take probiotics, I feel bad. Right now, I've become addicted to probiotics. And also, you be honest with you, you lose weight with probiotics. You know, you lose even weight. Like I've been, when I don't take my probiotics, I start gaining weight. But anyway, I don't wanna get in there. Don't get me, Eugene, to something. I don't wanna. Let's keep up with acne in here. So, but that's a good question. You can take probiotics any time of the day. So again, oral antibiotics, my favorite is doxycycline. I will take it for 2 months. After 2 months, we start, lowering the dose of antibiotics. Like if we take 1 gram, we say 500. So, and also, of course, if you have side effects of the antibiotics, we can stop it. We can use it something else.
Okay, that's actually what I was going to ask you. To see and ask you, like, what is your number one recommended oral antibiotic that you prefer or you would recommend as a doctor?
Yeah, I would love like a doxycycline, because erythromycin has a lot of side effects. So it can cause hepatitis. You could see in here, it can cause pancreatitis. It can, I love doxycycline because it's used a lot and basically has less side effects. So I will all the time. And also, be honest with you, doxycycline is really good for this bacteria. For the acne bacteria, is better than the erythromycin. So for me, like number one, I will not use any other antibiotic. Personally, if doxycycline didn't work, I will not prescribe any other. I will go to the next treatment. I will not prescribe. So at this time, I think doxycycline is the best antibiotics for what we call perennial bacteria, which is the bacteria that cause the acne in our skin. So that's number one. And like I said, we start 500 to 1 gram a day. So once a day, it's great medication. So let's see if this oral antibiotic didn't work. So what we can do, and like you have really severe acne, and you don't want that acne in your face. Then the next thing, we go to Accutane. And I know, Angela, you asked me last time about Accutane, and Accutane is the same as retinoic acids. The only difference is retinoic acids, it's topical, and Accutane is vitamin A. Like retinoic acid is vitamin A, we just didn't hear, but Accutane, derivative of vitamin A, but it's oral. But when we have it oral, it has more side effects than topical. Okay. Like if you want to take vitamin A oral, which is Accutane, then is like recommended for severe nodular acne, which is like patients when they get really severe. And what's your question last time about Accutane? You asked me about Accutane, Angela. So what's your question?
I was asking regards to Accutane. I know you have in the past mentioned the type of measures and steps that you have to take in order to be prescribed Accutane. Would you mind going over?
Sure. So as you see in my slide in here, when you take Accutane over here, you have to be monitoring your liver function test. In a way, it can hurt your liver. Also, you have to be monitoring your serum cholesterol and triglycerides, because it increases your cholesterol and triglyceride. And basically also in female, it may cause childbearing, he may talk like, some congenital deformation, some congenital disease. So all the women that are taking Accutane, there is what we call, they have to sign what we call I pledge. And I'll explain to you what I pledge. So like, for example, this prescription, it's not like, okay, hey doctor, I need Accutane and I'll prescribe it to you. No, you have to sign a form that it calls I pledge. And I will show it to you and what it is. And for example, that's what is I pledge. It's basically, it's designed to eliminate any fetal exposure to this drug, because like I said earlier, it can cause some really some bad congenital disease, and also it's kind of really be bad. So every woman that she wants to be under this treatment, she has to do first, she has to have 2 negative urine pregnancy tests. The first test can be done in my office, number 1. The second one, it can be done it can be done in my office. The second one can be done in the lab. Whatever, she go any lab to do it. The first one can do it, and they have to be bottom negative.
Okay.
That's basically 1 month before the treatment. So let's say you want to start in Accutane. Angela, you came to me, hey doctor, I want to start in Accutane. So I tell you, okay, we cannot start it today. We're gonna start it 1 month before right now. So before I was gonna start you're gonna sign that I pledge, book that you're gonna do. Today you're gonna do a pregnancy test in my office. Then you're gonna do another one in the lab, and I have to have 2 pregnancy tests negative, because I want to make sure before you start this medication that you're not pregnant. Because if you are pregnant and you start this medication, then you can have some malformation, some problem with your baby, some fetal problems.
Wow. Okay.
Congenital diseases. That's number 1. So the second thing, what I want you to do, I want you to have your liver test and your cholesterol test before you start. So I want to make sure your liver is normal, your cholesterol is normal before you do anything like that. So as you see in here, each month, you have to do a female pregnancy result test, okay?
Mm-hmm.
And also we have, like I said earlier, you have to measure your liver function test and your cholesterol test. And you have to do this test almost every month. Like for example, you do it this month, every month you're gonna do your cholesterol and your liver test function, your liver and pregnancy test also. So you have to do, as long as you are in this treatment, you have to do monthly pregnancy test, monthly liver test, monthly cholesterol test.
Okay.
You got it, Angela?
Yeah. So this is definitely more of an extreme type of treatment. How common is this treatment for people? Is this one of the amongst the most popular treatment that people are looking at, or
Yeah. So there's people, they don't want to take Accutane. They don't want to handle that acne. They say, you know what it is? I told them, okay, Accutane, are you okay to do it? They say, yeah, fine, I'll do it. But this is what you're gonna do. Cannot be pregnancy test, and I forgot, Angela. And also when you take Accutane test, you should be in 2 kind of form of contraceptives, oral contraceptives, so we don't get pregnant. So we have to start contraception.
okay.
2 forms of contraception. So I cannot give you that because I'm afraid to get pregnant. So before you start this treatment, I want to make sure you are in contraceptives, oral contraceptives, so we don't get pregnant.
Uh-huh. Okay.
So in a way, you're gonna do pregnancy test negative, but also I have to start you in oral contraceptive so you don't get pregnant. Because the problem is, if I start you in the Accutane and God forbid you get pregnant and something happened with your baby, then you can come after me as a doctor. So I may get sued.
Right.
So, and also it's not good. So I want to make sure you sign and I make sure you take a contraceptive test. Because if you're not taking it, you may hurt yourself. You know what it is, and that's very important that you take contraceptive test. And of course, there is some girls. They say, okay, look at this girl. She's in Accutane, so look at her face. So it's a big improvement between this picture and this picture.
Yeah, that's a massive.
Wow.
And if you ask me, Angela, if there are some girls who want it, yes, of course they want it. Because they say, okay, well, I'll take a contraceptive, hormonal. And to be honest with you, hormonal contraceptives are good for acne too. So, they sometimes, hormonal therapy is good for acne. So as long as they look good, they say, I don't care. I want to take the Accutane, but I want to make
I have a
sure
question,
it's good.
though.
That's what I was going to ask you, is that some acne is caused by hormonal changes, as we mentioned, and then I was going to ask if there should be any specific hormonal treatments that would target in order to help prevent more acne or the
Sure.
the
And during puberty, we have two hormones. We have estrogens, estrogens during the first period, and progesterones. Progesterones are the one, a lot of them, they turn out to be into androgens. They are the one that cause some kind of form of testosterone, which is cause acne. So when we do hormonal therapy, we mostly we want those hormonal therapy to be mostly estrogens. You know what is estrogens? We, as the women, that ovaries, they secrete estrogen and progesterone. Progesterone is the one that usually cause acne because they kind of, so a lot of this hormonal therapy are estrogens hormonal therapy. When we do hormonal therapy for, also there is some kind of ladies, I don't know if you heard about, there is a disease which is called polycystic ovarian disease. It's when women they have a big ovaries and they start secreting a lot of progesterone, a lot of so they get hair in their face, they get a little bit, they start gaining weight.
Okay.
They start gaining weight, and basically you see, and they get migraine headache, abdominal pain, and also they start, like I say, we call tension headaches. So a lot of these women, when we measure their testosterone, we find out their testosterone is very high, and we call a polycystic ovarian disease. And for these women, we give hormonal therapy also.
Oh, okay.
So so a lot of these women, they may end up in the OBGYN, like I say, they got like I said, irregular menses. They start having their menses like irregular one time they get it, one time they don't get it. They start gaining weight, they start having hair, start having acne, and that's different thing. This we call polycystic ovarian syndrome. And these patients, they're really treated with hormone therapy, estrogen. Also, they are treated with kind of form of spironolactone. But that's like a different thing about that.
This is interesting because
Now,
people think that acne is just a skin condition.
Yeah.
But to kind of dive in depth into, other areas of your body that really does cause these complications and, this condition, it's interesting to learn that it's much deeper than the skin. It's really,
That's right.
going on internally that causes a lot of damage onto your skin.
Well,
Sorry, what were you gonna say?
Eugene, you want to questions? Yeah.
After you take the Accutane and your skin clears up like that picture you showed us,
Yeah.
does somebody stay on Accutane, or does the dosage change, or they're taken off of it? How does that work once they get the skin that they want?
Yes, very, very good questions. So in Accutane, we basically we take about 4 to 6 months. 4 to 6 months of Accutane, and usually when you do 4 to 6 months Accutane, we'll stop it for a little bit of time, and because we don't wanna like you be taking Accutane for usually and usually your face will clear up by 6 months, because it's very a very good drug for and then we'll take time, we'll do that and we'll see. And then if they want to go back in Accutane, we'll probably after 6 months, after 4 months. So we go up and, we take them off because we don't want to hurt their liver. We don't, like, remember earlier, we don't want to do like damage also. And also some women, if they want to get pregnant or something like that, you're going to take them off a contraceptive. So I do between 4 and 6 months, then I stop for 6 months, then I'll come back if they want to go, but usually about between 4 and 6 months. I don't want to go more than 6 months when I'm with Accutane because of the side effects.
Okay. That's definitely interesting to know.
Yeah.
And
Okay.
Is that I feel like that's one of the more popular ones that I hear people talking about at least.
The
Is it the one that's been around the longest? Is that why, or like why is that one so
Well,
popular too?
yeah, Accutane probably is the most effective for acne. It just like I said earlier, it's not it may hurt your liver, it may increase your cholesterol, uh, and also it causes this fetal death because before in the past, Accutane has no eye pledge. It's like everybody can get it, like doctor. But after that, we realized this. Yeah, that's before. And actually, and it was taken out from the market for a while, Accutane, because we realized there's a fetal damage and fetal problems when you take an Accutane, miscarriage and all that stuff. So it was taken out of the market for a while. Then they introduced it back. So when Accutane was introduced back, they said, okay, we'll introduce you back. But guess, if you want to have it, that's what you should do. You have to sign this. You have to make, because they don't want to people go after the company, that fetal damage. So you're gonna sign, so you can get your urine pregnancy test. You're gonna take your contraceptive test. You're gonna measure your labs, and that's what you can do if you get that medication. And the reason why it's back to the market, because it gives some really great results, and people love it. And that's right now that's what we do. Yeah, it's great medication. And also there is hormonal therapy you can give, and this hormonal therapy, like I say, is mostly estrogen. There is all hormonal therapy is mixed between progesterone and estrogen. Progesterone is the one that makes those testosterone hormones. Mm-hmm. So we don't want to give like contraceptive that has the high progesterone. We not give a contraceptive that high estrogens, and that's basically what it is. So the same thing for polycystic ovarian syndrome I talked earlier. Does have the signs. The signs, like if you see in here, let me make it bigger. If you can make it huge, let me.
I have a question there too while you're pulling that up, doctor. Yeah. What is the effect on guys? Is Accutane for guys as well, or is it only for girls? Because you keep bringing up like
it's also for guys. It's for everybody.
Okay. Yeah. And what are some of the side effects for men?
Well, the side effects for men is, of course, is we don't get pregnant. So, so that's number. Yeah. So that's So we don't get pregnant. But the side effects is the same: liver and cholesterol.
Okay.
Yeah. So for a man, I have to measure his liver and cholesterol. So of course,
okay.
He's not gonna. We don't get pregnant, but the liver and cholesterol is kind of that's mostly what it is. The same.
Got it.
So, like for example, Angela was asking me about polycystis. Those who are polycystis sign is like we call it in medicine hirsutism, which is like hair growth. You start basically having severe acne. You start having irregular menses, like your menses is not good. You start getting gain weight. Infertility, all that stuff that that polycystic ovarian syndrome is, and the treatment for this polycystic ovarian syndrome is hormonal therapy, as you could see there. And the hormonal therapy is mostly in these women we give estrogen, and also we give a spironolactone. Spironolactone is very good because it blocks progesterone to get to androgen. I don't want to get in there. So, but mostly when you get to polycystic ovarian syndrome, that's like a disease that you have to basically go to your OBGYN or something like that, but that's more medical. But for just people, that's we talked today about oral antibiotics again, just because we have like about 1 minute to go. Oral antibiotics, doxycycline, that's we can add to topical. If that oral antibiotics didn't work and severe acne, then at the time we can add Accutane. Accutane is basically the best treatment you can have in that. And for next one, we're gonna talk how can you, because we have this aesthetic medicine, cosmetic medicine has become a big part of acne. The next episode or the next one, the treatment 3, we're gonna talk about different like microneedling, different lasers, all these mechanical treatment that you can add, like mechanical like pills and all that stuff that you can add to this treatment, because you can still take in medication, but you still can do this kind of mechanical treatment, which is lasers and chemical peels and all that stuff.
I'm really excited to talk about that next, especially because so many people are into, they want the mechanical treatments, they want the laser stuff, they want the light therapies and the microneedling and things like that. And I've obviously sat down and had treatment done with your wife Nada, my very first session for microneedling for my skin, and it was fantastic. My skin, I mean, even after one treatment and just being able to maintain it and just, taking care of my skin has helped a long ways. But I think people are so intrigued by the advanced technology that that you guys have to offer. So that topic I'm definitely excited to talk about as well.
Yeah, great. Like I say, it's it's really a good add-on to this treatment, acne treatment. The mechanical one, it's a really great add-on to it. It's amazing how technology advanced right now. Like acne before, it was it's not like easy right now with this mechanical treatment, because we do like a lot of laser, erbium laser, CO2 laser, and a lot of these really help a lot. Acne, scars from acne, and really right now, like I feel bad for those scars in the past, like somebody grow up and still have those big. So right now we could like with kids like now, if they take care of these things earlier, they can it helps a lot.
Yeah.
Now, I want to say though too, like for our audience that's going to hear this, you guys, if you guys have questions, we would love for you to message us about any of the things that we've talked about so far, and just looking forward to the next episode of the treatments that we can do. If you guys have questions about any of these, please message one of us, because we want to answer and get information out to you guys. That's why we're doing this, and we're so lucky to be able to have this opportunity. So,
and we'll put up all of the doctor's information on across the platforms, the YouTube channels, all of our social media. So you have direct contact with the doctor yourselves in order to, get a consultation if you need it, get in touch with them. I know we're kind of on lockdown right now, and so this is a great time to actually push the content and talk about these things that people are curious about. But yeah, you'll have like direct access to the doctor. So just but send us the questions, because this is a place to kind of gain the knowledge and learn something new.
Yeah, that's
so as we're finishing up here, doctor, if you could just remind us again the name of your place and where you're located for our audience, just in case they don't know.
Oh yeah, I am my business is Odi Rose Med Spa. I'm located right now in Orange County, Tustin, Newport Avenue, Tustin area, and I'm trying right now to open up in Inland Empire, Riverside. So kind of
we're excited about that. So
yeah. There's been asked, and I'm really, it's a great population over there. Really, they ask. I love people over there. So I was like, okay, well, no, I'll open up. Waiting for this.
Here.
Yeah. We love people over there, and they're hungry for information, for all the information and all that stuff. So I'm happy to open up over there. But so far, we are in right now at home. Take advantage, and you can ask me any questions, and it's free. You don't have to pay for that.
Well, thank you very much, Doctor, again for joining us. Again, my name is Eugene. Eugene does hair. We have Angela Cho, like I said, founder, creator of Lady St. Lucia Lashes. And until next time, again, if you guys have questions, please send us a message. We are here to help you. And if there's another topic too, as far as skincare, any of this that you think we need to talk about, reach out to us. We want to get you guys the information. And until next time, we will see you guys later.
Thank you. Thank you.
Thank you.